Welcome to Portavision Medical's presentation of the Virtual C-arm digital imaging system. Advances in healthcare are made from a willingness to face changes and challenges with innovative solutions that will shape the future of medicine as we know it. This willingness entails taking responsibility and recognizing opportunities in the marketplace by identifying the specific needs of those most in need. Portavision Medical has focused on developing technologically advanced, innovative mobile fluoroscopic X-ray systems to target specific, high-risk, and generally underserved clinical needs. We recognize the challenges associated with performing mobile X-ray procedures and applications outside of the norm and meet those challenges head-on through our dedication to innovation. What sets the Virtual C-arm apart from traditional imaging systems and methods utilizing a physical C or U arm is that the Virtual C-arm allows for dynamic image acquisition without the limitations of a mechanical linkage between the X-ray source and X-ray detector. Currently, physical C or U arms are used to ensure the alignment of imaging components during image acquisition. The physical linkage of the components has proven problematic in several usage scenarios, often putting critical care patients at a disadvantage due to the machine's physical limitations. The Virtual C-arm system instead relies on our novel collimator, featuring a built-in, X-ray source-to-detector alignment software, which we call the Machine Vision Collimator, MVC for short. There are numerous medical applications or scenarios for dynamic imaging where the use of a traditional mobile C-arm is impractical, such as performing complex line procedures, such as placing peripherally inserted central catheters, PICCs, which can be especially difficult in neonates, umbilical vein catheters or UVC, as well as completing needle aspirations. In neonatal intensive care units or NICU, as general solutions, are not sized for premature infants. Modified barium swallow studies in hospitals, nursing homes, and home healthcare settings. Utilizing four independent shutters to automatically position the radiation beam, the MVC ensures the area of exposure always remains within the confines of the active area of the detector, eliminating the need to physically link the components. A visual display provides real-time video of the patient, with a shaded area appearing on the video image to indicate the location and size of the radiation beam with respect to the patient. Additionally, the angle and inclination of the X-ray source is displayed to the operator on the display as well. For a typical procedure, the operator selects the fluoro option on the touch panel workstation monitor, then selects an APR station for the patient's size and anatomic region to be examined. Next, the operator places the detector under the patient and visually aligns the detector to the anatomic region desired. Then, the X-ray source is positioned over the patient, and visually aligned to the intended region by observing the live video image feed of the patient and the shaded virtual collimator area. The operator then initiates the alignment X-ray exposure, which is limited to a 1/2 by 3/4 inch radiation beam. The beam passes through the patient to strike the detector. The workstation computer transmits the alignment image to the MVC. The MVC then calculates the present location of the X-ray source with respect to the detector. The MVC will automatically reposition the shutters to align the radiation beam to the detector, and the size of the collimated area is adjusted for the anatomic region being imaged. At this point, manual manipulations of the beam size and location can be performed using the pinch and swipe touch panel actions. Pinching the touch panel, as you would to zoom in or out on a smartphone, will define the shutter opening relative to the beam output size. While swiping will move the shutter openings, adjusting the location of the beam itself while maintaining the desired shutter opening. Now that the X-ray source is aligned, and the collimated area is adjusted for the anatomic region to the examined, the system is ready to acquire fluoroscopic images using the techniques associated with the selected protocol. During the fluoroscopic image acquisition, each frame of the image is analyzed to determine if the exposed area of the detector touches any of its borders. In the event the image area approaches or touches the detector borders, the MVC will attempt to reposition the radiation beam towards the center of the detector. If repositioning of the radiation beam cannot satisfy the border constraints due to the mechanical limitations of the MVC, the radiation exposure will be immediately terminated as not to expose the patient to additional, unnecessary radiation. In this event, an error message is displayed, and the user is instructed to realign the X-ray source or detector in order to continue. We hope you have enjoyed our presentation. As always, your feedback is welcome and encouraged for future development of features of our devices. Also, please feel free to visit us at www.portavisionmedical.com. Thank you for watching.